So this recording will go on the website for people to look at afterwards. We'll be stopping the recording when we get to the Q&A section. So that will be kind of there for others to look at after the event. This will also kind of have, people will probably want to put out some tweets on this. So if you're not happy with your face being shown on this, then please switch off the camera, but feel free to use the chat function as well, if you can, to ask any questions as you're going along. Most people I can see have their name fully in there in the chat function, so that would be great if we have any questions afterwards that we know who to go to. Please make sure that you're on mute as well, because we're getting a bit of feedback at the moment. So if you can make sure that you're on mute as we're moving along, that would be good. The chat comments will be saved and the slides will be shared after the event as well. As I say, please, we'll be going through Jen's presentation and Amanda's presentation, and questions will be coming after that. So the running of the things, we've got until 1:30 today. We're going to have Amanda Hensman-Crook from HEE. She's the HEE AHP National Clinical Fellow. She'll be introducing and an overview of the roadmaps, and then we've got Genevieve Smythe, who's the RCOT Professional Advisor, who will be taking us through the occupational therapy roadmap in more detail, and then on to a Q&A session. So without further ado, I'm going to be swapping between presentations as well. So I will introduce you now to Amanda. Amanda, over to you.
Thank you very much. Hello, and thank you all for coming today. It's a really exciting day. It's your OT roadmap launch, and as Paul said, I just want to thank all of the people that have been involved in this. There's been an awful lot of occupational therapy input into this from both generally in general OT, but also paediatric OTs as well. So it's been a mammoth undertaking, and I have to give a lot of credit to Genevieve, who has put an awful lot of time and effort into this as well. So can we have the first slide up, please, Paul? So I guess the best place to start is, why did we do it in the first place? So it's really important that in primary care, because it's a new area of practice that we're working in, that we make sure that we have both patient and clinician safety. So there has never been a standard of practice before in primary care, and really clear capabilities at a level of practice. And it is a very, very different setting to working. You're working with undifferentiated and undiagnosed conditions with high complexity and high uncertainty. So it was really important that we put the patients right at the very heart of the roadmap, and obviously clinicians too, because we need to be safe as well. It was a great opportunity to develop a quick career pathway in primary care. So if you're looking at the whole pipeline from OTs from undergraduate through to consultant level practice, it just gives another opportunity to go off into a different healthcare sector to go and work in. And also mindful that we're moving into integrated care systems, sort of making it really helpful for you to be able to touch base with primary care confidently and safely, as well as working across the whole healthcare system. It was also really important to provide parity across all the AHP professions. So there's 5 professions that we're looking at in primary care. We've got physiotherapists, podiatrists, paramedics, dietetics, and OTs. And it's really important to know that it's all exactly the same roadmap, exactly the same level of practice, same supervision requirements and same governance, and that puts everybody on the same level playing field, so that everybody in primary care understands what level of practice you're working as a first contact practitioner and advanced practitioner. But it also means that all professions are equal, which is really important in the AHP world. So we needed to align all the practice and training and supervision in primary care, but it's not just about the AHPs, but it's also about the supervisory piece. I know that there's a few OTs that have now done the roadmap supervisors course, and we actually have a national trainer who's an occupational therapist. So it's really important to know that the roadmap supervision, particularly the stage 2 part of the roadmap, the part where you're putting academic practice into the clinical setting, that is an adapted version of the GP training. And the GP training What I mean by that is what happens for GPs is they go to university, come out as registered professionals, they work for a few years, and then they can go on to GP training courses to become a GP. So that's the same as AHP. So you'll see on the next slide, I'll explain more, but you're registered, then you come out, you spend some time consolidating your work, then you can do your primary care training, and you signed up. Thank you, Paul. It's signed off in the same way as GP training. So the work-based placed assessment toolkit is the RCG, and at the moment we're doing pilots with GP trainees. So roadmap supervisors are being quality tested by doing some of these work-based place assessments with GP trainees, which is massive. If this works out, that means we can also sign off some of our GP trainees for some of their assessments as well, which puts us really on the map to be able to help primary care out in a huge way. So if you look at this, he's lovingly called Colin. This is the capability caterpillar. If you look on the left-hand side in the green bubble, that's where you pop out as a registered OT. So if you look at the bottom, you can see it's the academic attainment that you're expected at each thing, but really importantly at the top, you've got years of practice. Now, the years of experience is super important, because that's when if you look at the gradient that goes up, it's a gradient that goes up through things as learning gradients. So you don't go to sleep one day as an enhanced practitioner and wake up as an advanced practitioner. There's a period of time that you run through it. So the years of experience mean that you're consolidating all of your academic learning in practice. You're learning about healthcare systems, you're learning about frameworks and all those kind of things. And it's really important that that the years of experience are there as well. We've often had people saying, well, you know, why can't I just do my training straight from college? Well, unfortunately, you might come out as a PhD student from registration, but it doesn't mean that you're used to working and doing your superpowers and your skills. And I'm sure Jen's going to talk about the OT superpowers later. Where first contact practice sits is at the top end of the enhanced bubble, and the bottom end of the advanced one, in that transition period that looks like a purple blob in the middle. So that's roughly where FCP sits. Next slide, please, Paul. So whilst the slide's coming up, I just want to talk about what is master's level practice. So it's divided into subject specific and also a generic ability. The subject specific stuff you'll be aware of anyway, because it's about that in-depth knowledge and understanding that's informed by current research. It's the critical awareness of current issues and developments, complex clinical reasoning, critical thinking, and how you understand research and are you able to apply that into practice. So that's the academic part. But the other part, next slide, please. The generic abilities is what people tend to forget about. And this is super important if you're thinking about doing the roadmap, particularly via the portfolio route, because you need to be able to demonstrate these skills, these everyday skills, like using initiative and taking responsibility, solving problems in a creative, innovative way, making decisions in challenging situations, learn independently and develop professionally, communicate effectively with colleagues on a wide audience of a variety of media. I know that OTs are super good at this anyway, but at a master's level, what that means in terms of your training to be a first contact practitioner, advanced practitioner, particularly in the portfolio route, although it needs to be demonstrated in the taught route as well. What it means is that when you have your roadmap supervisor, as a clinician, it's up to you to be able to map all of your evidence you're collecting for stage one, which is the academic evidence. It's up to you to put all that together, map it and take it to your supervisor. And your supervisor just looks at it and agrees or disagrees. So that's your independent learning. And on the taught route, what that means in terms of the taught route and how you can demonstrate that is that before you enroll on a course, on the first contact module, which contains both stage 1 and stage 2 in it, that you look for your clinical placement for 75 hours before you enroll. So that's displaying master's level ability to be able to communicate and to be able to learn independently. And it's really important. I can't emphasize how important it is to be able to do this. Okay, next slide, please. So as I alluded to, there's 2 different ways that you become a first contact practitioner. and an advanced practitioner. So you've either got a taught route and you've got the portfolio route. The reason we've got both is because it's really essential for equality that we allow lots of different ways of learning, and we're able to support everybody who wishes to get there in their career and they want to go along this particular career pathway. So in terms of the taught route, like I say, they've got stage 1, stage 2 in it, and then you pop out at the end of it as a first contact practitioner. If you want to become an advanced practitioner, you can use all of that learning against the multi-professional framework, the Advanced Practice Multi-Professional Framework, the Centre for Advancing Practice. So the FCP training means that you are demonstrating academic and academic knowledge into practice at master's level. And whilst it's doing that, the other 3 pillars of practice for advanced practice, of research, education and leadership, they're also topped up to a degree, but they're not topped up and proven to be at master's level. That's when you become an advanced practitioner, that top up bit. But you'll find that actually by doing first contact practice, you will be almost there in the other 3 pillars as well. And it's really mostly around the research and leadership pillar that you might need to think about sort of how you're going to develop in those areas. So the mapping part with the portfolio route, like I said before, in the behaviours about master's level behaviour, the mapping against the knowledge, skills and attributes document. If you've got a master's degree, it's gold dust because it probably maps most of the domains. There's 4 domains, and under each 4 domains, there's 12 statements, and you just have to have the learning outcomes of your master's degree to see where it matches on those statements. There'll just be the primary careness, if you like, that will be missing. It might just be one small piece of reflective work that you need to do. And the same with master's modules. If you have those, they're really useful to be able to use the learning outcomes against the knowledge, skills and attributes document. Quality improvement programs of work that you've done an audit. Again, absolute gold dust. They actually map across all 4 pillars of practice, to be honest. But you just need again to write a reflective piece. It's at master's level for your supervisor to be able to sign that off. But again, that will sign off an awful lot of the statements, the 12 statements across all 4 domains. And also research evaluation. If you've got a research club like some people do, and you go and you're evaluating research and you analysing it critically, then again that also counts. All that counts towards the knowledge, skills and attributes document. Next slide, please. So the last slide is really, for me, it's about the roadmaps to practice landing page, and I know that that Genevieve will pop all of these links up for you. It's super important that you get used to looking in and checking in with this page. So it will have occupational therapists. It might even have it on there today. I haven't looked in it today, but you'll have your roadmap on there as well. It's got all the supervision resources on there. It's got webinars that have been done before. There's 2 webinars that are really important with regards to what I've been talking about with the mapping that have been done by MMU. And it tells you what master's level practice is, what constitutes as master's level practice and how to map it. So it's well worth having a little look at those. They're really straightforward videos to look at. You've also got news and events. Now that tells you every week new things that are going on. It's also got, if you want to be a roadmap supervisor, all the regions will have their supervisor courses and all the links to it for you to do that. So anyone out there who's got a master's degree, postgraduate's master's degree that is, and they want to be a roadmap supervisor, look to go and do that. The beauty of being a roadmap supervisor is it also helps you towards advanced practice, because it will tick off nicely the education and leadership parts of your roadmap. And if you want to be a first contact practitioner, it doesn't matter if you're not one already, you can still, if you've got a postgraduate master's, do this, and that will help you towards knowledge, skills and attributes on that, but it also keeps you current. So the currency is really, really important when we're looking at our HCPC registration. So I think that's enough plugging of the roadmap supervision course now. I think what I'm going to do is actually hand over to Genevieve, and we'll catch up again in the Q&A later.
Thanks so much, Amanda. That was really, really so useful to help set up and frame the occupational therapy roadmap. And I'm going to talk in a bit more detail about actually what's in the roadmap. So specifically, what I'm going to cover is what the roadmap is for. Amanda has already described that, so I'm going to reinforce some of that for you. The levels of pillars of practice. Again, Amanda, you've seen Colin, the capability. I've got a slightly different diagram, but it's reinforcing the same message that's really important to understand about what exactly are the levels and the pillars of practice that we're talking about, because they're central to the roadmap. Reinforcing again what exactly is a first contact practitioner occupational therapist. And then finally, I'm going to talk about what is actually in the roadmap. So at 160 pages, it's about 160 pages. It's a very large document. So I'm going to break it down for you to make it more accessible. It's just gone live. So that's really great. And before I start, I just want to really say a huge thank you. There was a small steering group of your colleagues that helped to check all the matching and the cross-referencing in the document. They helped with the occupational therapy superpowers and the resources. You're all named in the document, but I'm very grateful to you for all of your hard work, and to Amanda and to Paul as well, because without all of us pulling together, you wouldn't have this great CPD resource. So many, many thanks. Okay, next slide, please. So what is the roadmap for? Obviously, it's mainly aimed at occupational therapists in primary care, those already in primary care or those who want to move into primary care. And it's very specifically around the first contact practitioner model. It's a very, very specific type of practice that's being used by the 5 AHPs in the R's in England, and they are physiotherapy, podiatry, paramedics, dietitians, and occupational therapists. So the roadmap is for FCP occupational therapists who want or need to be recognised on the HEE Directory of Advancing Practice. It shows you how to become an FCP and how you can then go on to develop to become a full advanced practitioner, as Amanda was just describing. So although that's the main intended audience, of course, it will be of interest to wider sections of the occupational therapy, AHP, and primary care communities. Next slide, please. So just to have another look then about the relevant levels and pillars of practice. And if you're familiar with the RCOT Career Development Framework that was updated this year and which maps to the HEE Multi-Professional Framework, and it all maps to this roadmap, there are 4 pillars of practice and 9 levels of practice that you can see. As I said, it's a slightly different diagram to the one Amanda has shown. So level 5 would equate to novice clinicians. So these are our clinicians who have a diploma or degree in occupational therapy. Level 6 are enhanced level clinicians. Level 7 are advanced clinicians. So those clinicians that have postgraduate master's level knowledge, skills and attributes. And level 8 is our consultant occupational therapists. So FCP occupational therapists are at level 7 in their professional practice clinical pillar. So they have excellent clinical skills, but they're generally lower in the other 3 pillars of learning, leadership and research. So the journey that the roadmap describes is the journey from an FCP occupational therapist to a full advanced practice occupational therapist. And that means moving to level 7 in those 3 remaining pillars. And that's the description in the roadmap. Next slide, please. So what is a first contact practitioner? So the definition and model of FCP is described in the roadmap and it's very distinct. It is a diagnostic clinician in primary care working at master's level with a minimum of 5 years postgraduate experience. They work with people with undiagnosed and undifferentiated diagnoses, managing complexity and uncertainty as the first point of contact for that patient or carer in primary care. Next slide, please. So what's actually in the roadmap? Well, as I said, it's a very large document, so I'm going to break it down into roughly 2 sections for you. The first section describes how to become a first contact practitioner, and then how you progress, if that's what you want, to become an advanced practitioner, moving up those other pillars as Amanda and I have described. Next slide, please. So that first section is about the first 40 pages, and it includes educational pathways that you'll need to use, how to build that portfolio of evidence working with a roadmap supervisor, what the recognition process of your portfolio is, the different types of supervision. It's a question we very often get asked, and there's lots of different types of supervision that you'll need in this process, and it's all clearly described in those first 40 pages. And finally, how you move from an FCP to an AP by topping up the remaining 3 pillars. Next slide, please. So the second section of the roadmap is the appendices. So the appendices actually form the largest amount of the document, and there's masses and masses of information in there for you. The first big chunk of those appendices are the workplace-based assessment tools, and these are all the tools that you're going to need for your portfolio. So there are templates for reflective logs, there's case-based discussions, there's quality improvement projects, patient feedback, multi-source feedback, personal development plans, and it's all just right there for you for your portfolio. We also have in there the core knowledge, skills and attributes. So the core KSA, and that's core, as Amanda has described, across all FCP clinicians in primary care. So all nurses and all AHPs are all working to this same level in this same set of KSA. And they've all been mapped to the RCOT Career Development Framework for Assurance, Safety and Governance. We also have the FCP Occupational Therapy Superpowers, and they are our key clinical areas, and they're older adults, mental health and vocation. We also then have the top up core knowledge, skills and attributes. So they're the 5 common capabilities across all advanced practice clinicians in primary care, again, mapped to the RCOT Career Development Framework. We also have the advanced clinical practice capabilities for primary care occupational therapy. So that's the profession's specific set of capabilities, and that was devised by a multidisciplinary steering group. And finally, we have information in there about all the e-learning courses that are available to you to help you on this journey. Pardon me. So I'm now going to go into a little bit more detail about the capabilities themselves. So the next slide, please. So if you look at any of the other roadmaps or advanced practice capability documents for nurses or AHPs in primary care, they all use this. So these are the common skills that have been identified across the multi-professional groups, such as communication, and there are profession-specific skills that I'm going to come on to in a minute. So you'll note here that leadership, education, and research are all here in the core KSA. Next slide, please. So the FCP Occupational Therapy Superpowers are key clinical areas according to the scope of the FCP role. This means that primary care staff, such as receptionists or patients who are self-referring for the first time before having a diagnosis, can be directly triaged to the FCP occupational therapist when they present as adults with undiagnosed mental health problems, contacting the surgery for the first time, older adults who are presenting with their first episode of frailty-related problems, and working age adults requesting a GP fit note. The roadmap gives indicative presentations that the primary care staff or patients can use so that the correct type of patients can be appropriately seen by the FCP occupational therapist. This type of care navigation is crucial to genuinely reduce the GP workload. So this is not an exhaustive list, but describes the most prominent areas of clinical practice for FCP occupational therapy in primary care at time of publication, so right now. There are new areas evolving, for example, FCP occupational therapists in paediatrics and social care, but they're at very early stages at the minute. Next slide, please. So the top up is the extra that is required to move from FCP Occupational Therapist to Advanced Practitioner. So the first 4 items are from the clinical pillar and the rest are from the research, education and leadership pillars as I've described earlier. Next slide, please. So this is what I describe as the gold dust. We've had a look at the core, those common capabilities. We also have the capabilities for primary care occupational therapy, advanced clinical practice. So the gold dust. And these are 28 interrelated capabilities for us in primary care. These are the profession-specific, obviously, capabilities. And they were devised by a Skills for Health and Health Education England multidisciplinary steering group with representation from Wales, Northern Ireland, Scotland and England. The steering group with expert patient experience, clinicians and academics was fundamental in ensuring the accuracy of these capabilities, which were then further refined following public consultation. So all contributions, whether you were on the steering group or you responded to the consultation, all of your contributions to the development of these capabilities are gratefully acknowledged. Okay, next slide, please. So in the development of the roadmap, some common questions emerged. So I'm going to tackle them now. The first is about the word diagnosis. So the roadmap says that FCP occupational therapists have extensive experience of assessing people and their presenting situations using occupational formulation to reach a working diagnosis in order to provide appropriate interventions. This means that in the FCP role, occupational therapists are using their clinical skills and training to reach a working diagnosis of the occupational problem and are also dealing with undifferentiated, undiagnosed conditions where the person's medical diagnosis is not yet clear. This happens because people often describe their presenting problem in very everyday language and will also save several problems up until they see a clinician in primary care. So you literally don't always know what the person is going to present with. I think the point here to stress is that where there is doubt or ambiguity, the FCP occupational therapist is not expected to make a diagnosis, but rather keep an open mind, formulate an impression as to what the cause of the problem may be, know what should be escalated to be ruled out, and when alternative input is required. This will involve the ability to recognise red flags, which may indicate the possibility of serious underlying pathology. So to give an example, someone may tell me that they're off their food at the minute and have lost weight. That might be because they're depressed and have lost their appetite and lost their motivation to cook for themselves, but it might not be that. So as the FCP occupational therapist, you have to know what to do with that. Next slide, please. So our final 2 questions. The first one is about medicines, and the RCOT position on this is clear and is reinforced in the roadmap, not just in the core KSA, but also in the occupational therapy specific capabilities as well. So our role in medicines is threaded throughout the whole of this roadmap. FCP occupational therapists have to understand the impact of medicines on occupational performance and participation and develop our full scope of practice in this area. So the core KSA in particular provides lots of detail. People have said they wanted more detail. There's masses of detail in there about exactly what that means. And we've linked it all to the many RCOT resources that are available to help you in this area of medicines. And the second question we usually get asked is, do I have to do this? And the simple answer is that if you are employed in England as an FCP occupational therapist to get onto the HEE directory, the roadmap is the only route to do that. So last slide then. So to finish, we have RCOT resources on our webpage. There are links to the Superpowers, which you can read in much more detail, and the roadmap is now live on the HE website. We also have a new evidence-based spotlight, which will provide you with some key reading from the evidence base about occupational therapy and primary care. It's intended to provide an introduction to the topic. Each paper has CPD activities applicable to the pillars of the RCOT career development framework and the roadmap. There's also a role descriptor. So there are other JD type documents in circulation, but this one is tied very clearly to the capabilities that are now out in the roadmap. We have a monthly drop-in and email network. There's a film also from the RCOT 2021 conference where I interview 4 clinicians about their roles in primary care. And again, it's just an introduction to the area for you, and many thanks to them for agreeing to be on that panel. And finally, I really would recommend the HE Roadmaps page. We're very, very lucky that several of our AHP colleagues have gone ahead of us, and there is so much information, frequently asked questions, other webinars. There's masses of information that can really help you immerse yourself and work out what's the best way of using what the roadmap is there to help you achieve. So use all the information that's out there, and do get in touch if you have any more questions. And that is it from me for now. Thank you, Paul. Over to you.